Hey there, micro friends. Welcome to another episode of Let's Talk Micro. As always, I am so happy that you're here with me. And if this is the first time you're listening to Let's Talk Micro, well, thank you for choosing it as one of your podcasts. Okay, so I thought this week, we will do a micro minutes episode. And if this is the first time you're tuning in, micro minutes is a short series within the podcast where we cover a topic in 10 minutes. And these are very short, and there's three of them so far. And if you go to our catalog, they're under, they're named micro minutes. One is about McConkey, one is about bacteria breaking the rules, which is discussing like oxidase negative Pseudomonas, non swarming Proteus, and more. And then the last one we did was about PEA. So I invite you to check them out. They're nice, short, quick, and they have some good information that is very important for the bench. Well, today's episode is titled Sometimes Gram Stains Lie. So I will be talking a little bit about gram stains and some things that you should know, and ultimately that will help you do your job better at the bench. And one of the first episodes that I did in this podcast was about gram stains where we went through the whole process. So I invite you to check it out if you're a student, if you want a quick refresher. So I'm not going to spend time on the procedure of it. By now we have discussed that. So I'm going to be talking about things you see in the microscope. But what I will say is that it's such an important and valuable tool. And as you know, it has four reagents. It provides such valuable information. But this, the technique, it takes a while. It takes a lot of repetition to get right. And even then, you still make mistakes. So it's very important to get familiarized, do that repetition. That way, when something goes wrong, you still kind of have that feeling and you can spot it. And at least, you stop and take a second look, maybe ask someone, and then move on from there. And of course, when you're in school and then you start working, some of the gram stains, they become really easy quick, right? You can really, you do the procedure and you can spot gram positive coccyne clusters, chains, you can see gram negative rods. I think that sometimes, the one that we might struggle with the most might be with the gram negative diplococci and also with the gram negative coccobacilli like Haemophilus and Pasteurella. And I'll talk a little bit more about that. But what if you go through your process and you're expecting something, for example, based on the history, and you are performing your gram stain and you're expecting, let's say, gram positive cocci, and all of a sudden you put that slide there and you see, let's say, gram negative cocci, or you are expecting a gram negative and then you put your slide, and after you go through the process, you see a gram positive on your slide, right? But with the repetition, with the process, you know that something is off. So, what are some things that can affect your gram stain? That even though you are looking at something on your slide, the information that you're seeing is not accurate. Well, one fundamental thing from gram stains is that, right, the organisms stain a certain way based on the properties of their cell wall, right? Gram positives have that thick peptidoglycan layer, which basically what it does is that the primary stain, which is the crystal violet, that cell wall, it retains that primary stain. And your gram negatives, they have a thin peptidoglycan layer, and then they have the outer membrane. So basically, ultimately, what they retain is your counter stain, which is your safranin, and then they stay pink. So your gram positives retain the primary dye, which is your crystal violet, so they stain purple, and your gram negatives, your counter stain, which is the safranin, which is pink. So, knowing those fundamentals, one thing that can affect your gram stain results, is the age of the culture. So, let's say you have an older organism, maybe the cell wall deteriorates, and that can affect your staining. Something else that can affect your staining when it comes to the cell wall, it's antibiotics, right? So maybe your sample was collected after the patient was placed on antibiotics, and that can affect your staining. You can see sometimes, variable staining, and then you see the cell wall that it gets like very elongated. Sometimes, it even looks like fungal like. And you see that with gram negative rods. Sometimes after the patient has been placed on antibiotics, you see these very long rods, and sometimes, they have like this little like circle at the center. So they definitely look very abnormal, right? And they can stain variable. But it makes sense, right? Because you're having a drug that's, let's say that is targeting the cell membrane, and then that affects the properties of it. So ultimately affecting your staining. And I have seen that on the bench, sometimes you get, let's say, a blood culture sample, and you do the staining and you see this weird rods that I just mentioned. And then you go back to the patient's history, and the patient maybe has some blood cultures collected from like 3, 4 days ago that had, let's say, classic E. coli. And then on day 5, you have this weird looking gram negative run. But as I said, this comes from a place of repetition. And eventually, if you do this long enough, you'll see some of those. But keep that in mind. You see that abnormal thing, before you call it, let's say, like fungal elements or something, make sure that you check the patient's history, maybe repeat a stain or ask someone. So just to recap, the age of the culture, maybe you have a plate that's been sitting there, being incubated 3, 4 days. It might stain abnormal. Or maybe you have an old sample that's been out there for a few days, and that can affect your staining. And then, of course, antibiotic usage. Okay, so moving along to stay in the spirit of the 10-minute episode, something that can affect your staining, of course, it's your decolorization, right? That's a very important step, and it's one that takes a long time to master it. And even then, you still mess it up sometimes. So always be careful. And with the procedure, it says you add decolorizer for 3 to 5 seconds. And there are a couple of ways that you can do that, which is applying the decolorizer and then counting, 3 to 5 seconds, or kind of holding your slide, like vertically and adding your drops for 3 to 5 seconds. But keep in mind, if you have a very thick smear, then you're adding more decolorizer, right? Because the objective is when you add in decolorizer, you're looking at the purple, you're watching it wash away. And if you have a very thick smear, that whole process is gonna take longer. So resulting in maybe an over decolorized sample. But let's say that even if you over decolorize or under decolorize, right, from a place of practice and repetition, you have to be looking at some other things, right? You're looking at your morphology, your arrangement. So even if you see something that looks like gram negative cocci, let's say, but you're looking at the morphology and then in the arrangement, and you see that the arrangement is like clusters or chains, then you know something is off because that's not a normal arrangement for gram negative cocci. So when you see that, at least you know to ask someone, maybe repeat the stain and take a second look. The same goes with rods, right? Think about gram-positive rods. You have things like boxy, like bacillus. You have lung and thin, like lactobacillus. You have coroniform, like corynebacterium. So if you see something that's staining negative, but let's say it has that morphology or arrangement typically of those gram-positive rods that I mentioned, that's worth a second look. That's something that you have to keep in mind when you're looking at slides. The same is true of something that you see that is staining gram-positive, but maybe the arrangement doesn't match that of a typical gram-positive rod. You're looking at the history. So that's why I say, you're looking at so many things. You're looking at the patient's history, you're looking at arrangement, morphology. So all those things you have in mind when you're looking at slides. And of course, when it comes to staining, I always like to tell people to keep an eye on Acinetobacter, right? That's one that you see that sometimes new texts call gram-positive cocci because they do like to retain that purple stain sometimes. And maybe you can repeat the slide and you can still get the same result. However, Acinetobacter, yes, there are plump coccobacilli, but they are larger than cocci and they don't have that cluster chain arrangement. You see them like single or maybe in pairs, but you don't see that cluster or chain arrangement. So that's something to keep in mind when you're looking at these. So always be very careful. And I always invite the students to do gram stains of, let's say, Neisseria gonorrhea, Acinetobacter, and Pasteurella, and look at them all side by side so you can compare the different sizes. And I'm gonna wrap the episode talking about Pasteurella and Haemophilus, but before I do that, let me quickly recap some things that can affect your gram stain. One is the age of the culture or the sample. Another is antibiotic usage. And of course, decolorizing, either under or over. That's a big factor that can affect the results of your slide. Now, even let's say you have done your procedure, you have done it the correct way. You're looking at your slide and there have not been any mistakes. It is a gram negative, and now the issue is you cannot tell: is it a cocci? Is it a rod? Well, when you have that scenario, you probably have Pasteurella or Haemophilus. Those are coccobacilli. They're very tiny, some of the species, and sometimes you have a hard time telling if they're cocci or rods. And some things that can help you with this is the size. So let's say Neisseria gonorrhea, which is a gram-negative diplococci, they are larger than your coccobacilli. And you can clearly see that kidney bean or coffee bean shape. And then the other is, scan the slide. When you have that scenario where you cannot tell if you have a cocci or a rod, keep looking. And if you're looking around and maybe in some fields you see some tiny rod shaped organisms, then you have a gram negative rod and not a cocci. Because when you have a true gram negative cocci, you don't have a rod shaped organism in there. If you have an Neisseria gonorrhea or a Moraxella catarrhalis, let's say, what you see is gram negative cocci. So scan the slide, you see maybe some tiny gram negative rods, then you have a rod and not a cocci. And that, my friends, is the end of this episode. I hope you enjoy this. It's a short, quick episode with some information that hopefully can help you when you're doing your work on the bench. Okay, so as always, you can find us on any podcast platform. If you go to Apple, Spotify, Amazon Music, Good Pods, you can find us there. So I invite you to subscribe to the podcast, download episodes, and if the app allows you to do so, please leave a review. Thank you so much for the support. As far as socials, you can find us on Instagram, TikTok, Blue Sky Social, YouTube as Let's Talk Micro, X as Let's Talk Micro 1, LinkedIn as Luis Plaza. And then there's the website, letstalkmicro.com, where you can find information about episodes, study resources, licensing information, and more. And of course, there's an email, which is letstalkmicro@outlook.com. So either via social media, via email, you can reach out with any feedback, any topic suggestions. They are always welcome and appreciated. And I also invite you to subscribe to the website. As you know, one of the challenges in clinical microbiology is learning about antibiotics. So if you're looking to learn more about antibiotics, please check out www.learnantibiotics.com and the Learn Antibiotics book, available on Amazon. These resources include cheat sheets, practice test games, and more, and they are being used by thousands of people worldwide and may be helpful for you or your colleagues. As always, these are some great resources from Dr. Timothy Gauthier, a very passionate pharmacist. And hey, if you want to support us in any way, you can do so via Venmo or via Buy Me a Coffee, KOFI, both links available on the show notes. And the Let's Talk Micro podcast is supported by the American Society for Microbiology. To learn more about microbes, visit asm.org. And that, micro friends, is the end of this episode. I hope you enjoy learning about gram stains in this quick episode of Micro Minutes. As always, I enjoy sharing this information with you. As always, stay tuned. Great things coming your way. Great content. Thank you so much for the support. I appreciate it. Please continue bringing that passion to what you do. It's so important. You do such great work. So, as always, stay motivated, stay safe, and of course, continue talking micro. Until the next time. Bye.